Hello, everyone. Welcome to the Office of Child Care's webinar regarding the new rule. We just want to make a quick announcement that we're just waiting for all of the attendees to trickle in. There's about 1,600 folks registered for this, and once we're at a good place and there's enough participants in our room, we will proceed with the presentation. Um, Thank you so much for your patience, everybody. Hello, welcome everybody. Just want to do a second introduction for those folks trickling in. We do have about 1,600 participants registered for today. We're just waiting for everybody to trickle in, and once we're at a good number, we will start the presentation. Thank you so much, everybody, for your patience. Hello, everybody. Welcome again. It is the top of the hour at noon. In the interest of everybody's time and wanting to respect, everybody's time, we will proceed with the presentation.
Hi, everyone. Welcome. We're going to take a few more minutes just to let people continue to log in and get settled. All right, I think we can get going. Perfect. So good morning and good afternoon, everyone. I am really excited to be with you here today to talk about the Biden-Harris administration's new final rule for the Federal Child Care and Development Fund program. The rule is going to reduce costs for families that receive child care subsidies, increase their the family's child care options so that they can better find the care they need, and make the program's payments to child care providers more appropriate and fair. This rule was published last Friday and will become effective on April 30th. It delivers on the president's executive order on increasing access to high-quality care and supporting caregivers, which was signed by the president in April 2023. The rule is a culmination of a regulatory process that began last summer when the Department of Health and Human Services released a notice of proposed rulemaking. We received more than 1,700 comments from the public on that proposal and made updates to the proposed policies based on that feedback. You can go to the next slide. So for those of you not as familiar with CCDF, it is the primary federal funding source devoted to supporting families with low incomes, access childcare, and to increasing the quality of childcare for all children. CCDF is administered by state, territory, and tribal governments and provides subsidies to help families afford childcare. About 1.3 million children under the age of 13 and 800,000 families receive CCDF assistance each month. The program plays a vital role in supporting the development of children and the economic well-being of participating families. We know that access to affordable, high-quality childcare has numerous short-term and long-term benefits for children, families, and society. Childcare is simply a necessity for most working families with young children in this country, and reliable access to care leads to better employment and earnings for parents and supports parents' educational attainment. Reliable access to high-quality care also positively supports children's development during their most formative years. But childcare is expensive, and without help paying for childcare, the cost can mean that parents have to reduce their work hours or quit their jobs altogether, or even seek out care that is less reliable and less safe for their children. At the same time, there isn't enough childcare in our country to meet the needs of working families, and childcare staff receive some of the lowest wages of any profession, despite the essential work they do every day. The importance of affordable childcare to families, businesses, communities, and to a strong economy is why the Biden-Harris administration has called for significant new investments to make sure no family in America pays more than $10 a day for childcare, and so preschool is available and free for all 4-year-olds. We want to make sure that all families can find and afford the childcare that meets their family's needs. Though significant new funding and fundamental system reform are going to be needed to achieve that goal, this rule takes immediate steps in the meantime to strengthen the existing federal program for the participating families and the many childcare providers that serve them. You can go to the next slide. So the rule includes many changes with important benefits for the families participating in the program and childcare providers caring for their children. First, the rule is going to lower costs of childcare for more than 100,000 families that receive subsidies through the CCDF program. Currently, some families participating in CCDF have copayments that are a significant and destabilizing financial strain on family budgets and a barrier to participating in the program and maintaining their employment. So the rule both caps family copayments and makes it easier for states to eliminate many more copayments altogether. These changes will shift costs from the family to the CCDF program so that family costs can go down without changing the amount providers receive. Second, it's going to require states to use more of the same payment practices to childcare providers that exist in the private market, and more than 140,000 childcare providers will benefit each year as a result. Currently, many CCDF provider payment rates and practices really limit parent choice in childcare arrangements. They destabilize provider operations, they disincentivize provider participation in CCDF, and they do not adequately cover the cost of providing childcare. This rule is going to result in more timely payments to childcare providers and payments that better account for the cost of providing care. By doing this, the rule will make the program more stabilizing for providers, make it easier for childcare providers to serve families participating in CCDF, and ultimately will increase parents' childcare options and their ability to find the care that meets their family's needs. And finally, the rule is going to reduce the red tape for families looking to enroll in the CCDF program. It includes important clarifications that will help make enrollment faster and easier so that parents don't miss out on job and education opportunities while waiting for childcare subsidy to be approved. We want to make sure the program bureaucracy does not get in the way of families earning money and pursuing needed work, training, and education opportunities. These are all important program changes urgently needed for families and childcare providers. And while we know they may take a bit of time to get in place, the Office of Child Care looks forward to working in partnership with states, territories, and tribal nations and other stakeholders across the country to implement these key improvements as swiftly as possible. And with that, I am now going to turn it over to Megan Campbell. She's a senior child care program specialist in the Office of Child Care to walk you through some of the details of this rule. This is just the first of many opportunities for us to work together to build a stronger CCDF program that will meet the needs of the families it serves. Megan?
Thanks, Ruth. And we can go to the next slide. Thanks. Hi, everybody. As we said, I'm Megan Campbell, and I'm in the Policy Data and Planning Division in the Office of Childcare. And now that Ruth has given the overall information about the benefits that this final rule will have for families and providers, I'm going to share a few of the highlights about the specific requirements that we included in the final rule. I won't be able to go through all of the changes, so please make sure to read the rule itself and the preamble and look forward to more webinars and other resources to provide more detail. So starting out, when we are focusing on lowering family costs for families participating in CCDF, the main requirement is that we are now requiring lead agencies to cap co-payments at 7% of family income. That's regardless of the size of the family or how many children are in care. Also, that cap applies during the regular eligibility period as well as any sort of graduated phase out. This is a cap, it's a maximum. Lead agencies have the option and are encouraged to set co-payments lower than the 7%. We've also made several changes to make it easier and to encourage lead agencies to waive co-payments for more families. Based on the 2016 final rule, lead agencies could waive co-payments for families with incomes under 100% of federal poverty line, families who may be in need of protective services, and then other populations as defined in their CCDF plans. We wanted to make it easier for states, territories, and tribes to waive copays for more families. So we have added the option to waive copayments for families with incomes up to 150% of federal poverty line, about $45,000 for a family of 4, and for families with a child with a disability. We proposed both of those populations in the notice of proposed rulemaking that Ruth mentioned. Based on the comments we received, we have added 3 additional groups to that list as part of the final rule. And that includes families who are experiencing homelessness, children who are in foster care or kinship care, and children enrolled in Head Start or Early Head Start. These are not the only populations lead agencies can waive co-payments for. They continue to have broad flexibility to waive co-pays for other populations and to make childcare more affordable for more families. But by including these groups in the new final rule, we're making it easier for lead agencies to waive them and encouraging it and making it clear that it's allowable. Next slide, please. The other big area we have made changes are related to payment practices so that we can better align with the statutory requirements in the Child Care and Development Block Grant Act that say that payment practices must reflect generally accepted practices for private pay families. The first is we are requiring that child care providers be paid either in advance of or at the beginning of the delivery of child care services or being paid prospectively. This means that reimbursement or paying 21 days after submitting an invoice, which was previously allowed, is no longer an option. Reimbursement-based payment practices are destabilizing to childcare providers and make it difficult for them to plan ahead, cover budgets, and pay for their staff. So we are requiring that lead agencies pay providers prospectively. We've also changed the requirements around delinking payments from absences. We are requiring that childcare providers be paid based on enrollment, not attendance. So a childcare provider must receive the full payment for a child's authorized enrollment, regardless of the child's attendance. The requirement around paying based on enrollment is to the extent practicable, and lead agencies do have the option to propose an alternative so that as long as it does not undermine the stability of childcare programs. We will review any alternative options as part of the plan review. I do want to point out that under the 2016 final rule, there were 3 options for delinking attendance from payment. The enrollment base, which is now the requirement, the option to pay the full rate if a child was absent 5 or fewer days, or the option to pay the full amount if a child attended 85% of the time. The preamble to this 2024 final rule states that those two options will not be accepted as alternatives because they undermine providers' stability and would not meet the new requirements. For both paying based on paying providers prospectively and using enrollment-based payments, so generally accepted payment practices, these apply to all childcare provider types. But we did receive many comments stating that for certain limited populations of providers, particularly more informal care, these may not actually reflect the generally accepted payment practices. Therefore, we have included a very limited exception that where a lead agency can propose to exempt certain providers from this requirement. They must provide evidence that these options are not generally accepted for those providers, and we will be very limited in what we will accept so that it does not undermine the providers, as we've stated. We are also requiring the use of some grants or contracts to cover direct services, so effectively slots, to help build the supply of care and help stabilize childcare providers. We are requiring that grants or contracts be used to build supply for infants and toddlers, children with disabilities, and children who need care in underserved geographic areas. Lead agencies can absolutely use grants or contracts for other populations, but they must use them for these three. In the NPRM, we proposed requiring some grants or contracts to build non-traditional hour supply as well, but we got a lot of comments pointing out that a grant or a contract may not be the best mechanism for building non-traditional hour care. So we are not requiring grants or contracts for non-traditional hour care. Instead, we have beefed up that language in the regulation, and we'll be requesting more information from states, territories, and territories to show the way that they are building and investing in non-traditional hour care. Lastly, for improving payment practices, we are making it clear that it's allowable, as well as very highly encouraged, that lead agencies can pay childcare providers the full subsidy rate that was established by the state or territory or tribe, even if that rate is higher than the price that childcare provider charges private pay families. Many areas, the price of care is determined by what families can afford. It does not reflect the high cost of providing high quality care. So it is important that when a lead agency sets a high payment rate, that payment rate gets to the provider and is not cut simply because they have to set a lower price in their community. We know that some areas this practice may not be allowed, which is why we have made it encouraged, but we do want to emphasize that from a federal perspective, this is an allowable use of CCDF funds, and we encourage lead agencies to adopt this practice. Next slide. And in the area of making it easier and faster for families to enroll and participate in the CCDF program, we are requiring the use of eligibility policies that minimize disruptions for families. Previously, there was a requirement to minimize disruption for families when they were applying for redetermination. This final rule extends that to initial determination. So it's very important to make sure that families are not kept out of the subsidy program simply because of the high barrier to entry, and we can help enroll more families to access needed assistance. We also have several encouraged policies related to making it easier for families to participate in CCDF. The first is related to presumptive eligibility. This final rule makes it clear that lead agencies may allow for presumptive eligibility for up to 3 months while a family completes the full eligibility process, which we know can be daunting and require significant paperwork. And that can delay a family's ability to access the childcare they need so that they can work, go to school, or go to training. Lead agencies have the option to move forward and adopt presumptive eligibility policies. And if a child is found not eligible during that 3-month time, the lead agency does not have to pay that back to the federal government. We are also encouraging the use of documentation from other benefit programs that have similar eligibility requirements to CCDF to make it easier to enroll families into the CCDF program, also to help limit duplication across programs and help with administration on the lead agency side. And lastly, with this one, we are encouraging the use of online applications and online enrollment procedures for initial eligibility determination, as well as redetermination. Next slide, please. Well, those are the big policy changes we've included in the final rule. We do have some clarifications we have added that are based on what we have learned on implementation of the 2016 final rule. The first is related to consumer education and full monitoring reports. The 2016 final rule requires states and territories to post full monitoring and inspection reports, but we have never defined what a full monitoring report is. These new regulations define a full monitoring report as something that includes all of the compliances and non-compliances from an inspection. We are also adding clarification related to aggregate data posting. States and territories have been required to post annual aggregate data about serious injuries and deaths in childcare settings based on broken down by licensing status and provider type. They were also required to post the total number of children in care, but that was only addressed in the preamble to the 2016 rule and not the regulatory language. It has led to some confusion. Therefore, we have added it into the regulatory language to make the implementation clearer. Also, related to clarifying eligibility for additional siblings, the CCDBG Act of 2014 and the 2016 final rule both make it very clear that children must have at least 12 months of eligibility when participating in CCDF. However, they were silent about what happened when there's a new sibling or a new child in the family unit. That child must still receive 12 months of eligibility, and we have clarified that in the new rule. We do encourage lead agencies to extend the existing child's eligibility period past the 12 months so it can align with their new sibling. As a reminder, the 12-month is a minimum. Lead agencies can go longer for an eligibility period. And lastly, we have added very technical clarifying language related to background checks. There are not any changes, though, to the requirements or policies related to criminal background checks. Next slide, please. And then a few additional provisions I want to mention. First, we know that a 60-day effective period, so April 30th, will be maybe difficult for some of these provisions. Many of the changes may require legislative or regulatory approval. They may also require significant systems investments and upgrades. Therefore, we are allowing lead agencies to apply for 2-year waivers, transitional and legislative waivers, to have additional time to come into compliance. We use these temporary transitional and legislative waivers to help implement the 2016 final rule, and we are bringing them back for the 2024 final rule. We did make a change from the previous version. Before, the transitional waivers were 1 year with a 1-year extension. We have made them now just 2 years. There will not need to be a time for applying for a second year. So hopefully that will help with some of the burden. Also, we got a lot of comments that were very supportive of the steps we are taking to make childcare more affordable for families, including capping the copayment at 7% and allowing lead agencies to waive copays for more families. But those same commenters often pointed out concerns about the fact that those lower copayments should not mean that a childcare provider is receiving less funding. So we are requiring states and territories to demonstrate in their plan that the total payment to the provider, so the subsidy payment from the lead agency plus the family copayment, is not impacted by cost sharing policies. Lastly, and this is somewhat technical, but we are updating the definition of major renovation. The previous definition was focused on the type of renovation that was happening. So anything that had a structural change to the building or had extensive alteration to a facility was considered a major renovation. Anything that was not that was a minor renovation. States and territories cannot use CCDF funds for major renovations, and tribes can, but only with ACF approval. The previous definition was sometimes a bit subjective and difficult for folks to know what fell into a minor renovation category, which may have discouraged some lead agencies and states and territories from investing in necessary minor renovations. We have updated this definition now to be more of a hybrid. We are saying that anything above $350,000 for centers and $50,000 for homes, and we will adjust that annually for inflation, is considered a major renovation. However, we did hear that that level may be too low for some areas with very high costs of living and high costs of supplies and construction. So, and therefore some of things that may have been minor renovation in our old definition would now be considered major. So we have incorporated the past definition in. So if something is more than the dollar threshold, but would not meet our old definition, so it's not a structural change, it would not be considered major renovation. We hope that clearer guidance around this, and it's explained more in the preamble, will help states and territories and tribes be able to invest in minor renovation changes to continue building much needed childcare supply and investments in childcare facilities. We will be issuing more guidance around this topic specifically. Next slide, please. So in the NPRM, we only proposed a few changes for tribal lead agencies. We knew that we needed a much more significant period of consultation, both formal and informal, before we made significant changes to the tribal CCDF program, which is what we did through our request for information. And as that has been mentioned, that is a separate process, so it won't be reflected here. But we did make some changes for tribes to increase flexibility and hopefully and to improve the administration of tribal CCDF program. The key one here is that all tribes may now waive co-payments for all families in their care. They are now exempt from establishing a sliding fee scale. If the tribal lead agents, if a tribe with a medium allocation or large allocation chooses to keep a copay, which is allowable, they would have to cap that copay at 7% of family income. We've also extended the period for tribal construction and major renovation. Currently, tribes have 3 years to spend to complete construction and renovation funds. We are extending that effectively to 5 years with a 3-year obligation period and a subsequent 2-year liquidation period. So tribal lead agencies will have 2 additional years to complete construction and major renovation projects. Next slide, please. And then also, tribes are exempt from many of the new requirements that we included in the final rule. They are exempt from the new consumer education requirements. And as a reminder, all tribes are exempt from the websites themselves. They're exempt from the requirement for grants or contracts, though we encourage considering if a grant or contract would be a useful way to build supply in the service area, and also exempt from the changes to the payment practices requirements. Next slide, please. So to recap, for states and territories are required to cap family copays at 7% of family income, regardless of the size of the family. They are required to pay childcare providers prospectively and based on enrollment with very limited exceptions. And they are also required to use grants or contracts for direct services to build the supply of care for infants and toddlers, children with disabilities, and in underserved geographic areas. Lead agencies states and territories are allowed to and strongly encouraged to waive co-payments for more families, pay the full rate to the child care provider, regardless of the price that they're able to charge private pay families, and use presumptive eligibility to help enroll families more quickly so they can access the care they need. Next slide. And then for tribes with medium and large allocations, they would have to cap copays at 7% if they choose to keep copays. But with the new flexibility, all tribes can choose to waive co-payments for all parents. We have adjusted the definition for major renovation to hopefully be clearer and support additional construction, major renovation, and minor renovation investments, and have set a longer timeline of 5 years for construction spending. As I mentioned, tribal lead agencies are exempt from requirements around payment practices and grants and contracts, but we encourage using those types of practices to help build supply and ensure stable payments to providers. And we encourage additional steps to make it easier for families to participate in CCDF, including the use of presumptive eligibility and online or easier applications. Next slide. So looking ahead, first I want to highlight that we do have a resource page where we have summaries about the rule and a red line of the regulatory language. We will be adding many more resources, including recordings of this webinar, FAQs, topic-specific fact sheets, etc. So we encourage you to visit there regularly. We know that the CCDF plan and the final rule are very, very interconnected. We got a lot of comments reminding us of that as well. So the 2025-2027 state and territory plan, the final version, will be released this month in March. This rule becomes effective April 30th, 2024. We will start taking waiver requests for the transitional and legislative waivers beginning in May of 2024. And then we'll be assessing compliance with the rule during plan review this summer. We will be issuing more resources on the rule, the plan, and the waiver process, each of them individually, and especially how they work together in the coming weeks and months. So with that is my last slide. So I am going to wrap up, but I just want to thank you all for joining us today for this overview webinar. Please keep an eye out for additional resources and webinars. And we look forward to partnering with you as we implement this new rule to help make it easier for families to access childcare and make it more affordable and help stabilize and support childcare providers. Thank you.